Okay, this is Taylor Welch presenting for pharmacology. So the first question, based on your first impressions of this patient's actions and appearance, what do you expect that she is suffering from? So the patient obviously looks bad. She's screaming obscenities and foul, scraped her arm and face. She's bleeding, disoriented, combative, and accusing the EMS team of stealing her purse. She's also shaking severely and shouting that she needs a bottle. She's very dirty and you can smell body odor and urine. So initially, I was concerned that this patient could be suffering from dementia, as some of her behaviors are similar to those exhibited in dementia patients, which the textbook tells us are like confusion, disorientation, and hostility in some cases. The patient seems really disoriented, with the patient asking for a bottle and accusing the EMTs of stealing her purse. I thought that that might be due to the confusion from the patient not knowing where she was or how old she was, which could be dementia. However, upon further examination of the physical state of the patient, I think it is clear that the patient is actually suffering from substance abuse, most likely alcohol abuse, hence asking for a bottle. We know that substance abuse can lead to the same symptoms the patient is experiencing now, more so than the symptoms of dementia. However, the patient could be taken in to be monitored for both. Her substance abuse could be leading to mental disorders. Okay, so question two. What short and long-term health risks would you suspect this patient faces? So, according to the National Institute on Drug Abuse, there are a lot of ranges in short-term and long-term effects of substance abuse depending on the substance being consumed. Some of the short-term risks include change in appetite, wakefulness, heart rate and blood pressure changes, mood changes, psychosis, overdose, and death. Long-term risks for substance abuse can include addiction, brain disorder, heart or lung cancer, HIV/AIDS, and mental illness. I think for the long-term risks, the HIV/AIDS would mostly come from people who are obviously abusing intravenous drugs that require needle use, which this patient could be doing as well. Question three, why do you think the patient's hands are shaking? And what do you think causes her confusion and combativeness? So, according to Healthline, there are different levels of symptoms in patients suffering from alcohol withdrawal. So, if you haven't been chronically using alcohol or been experiencing withdrawal for a short time, your symptoms might be more mild, but still include things like tremors, nausea, anxiety, or high blood pressure. However, those patients who have been chronic users of alcohol and, experiencing withdrawal for a longer period of time, they can have more extreme symptoms. These are more commonly referred to as delirium tremens. So it's extremely likely that this patient has delirium tremens and was a chronic alcohol user because she is exuding the symptoms, which are extreme confusion, extreme agitation, which would lead to her combativeness, and different formats of hallucinations. So she could have been hallucinating that someone stole her purse, or, other where she even is, who she is, how old she is, things like that. Question four. What assessments do you think are needed for this patient? So this patient is clearly going to need a psychological evaluation and a mental checkup. The patient could very well be exhibiting mental disorders or developing addiction issues, and the psychological evaluation is going to help determine that and what further steps the patient needs psychologically to recover from that. Because the patient also has scrapes, bruises, and poor physical hygiene, she's going to need a physical exam to address the scrapes, lesions. She could have infections from poor hygiene. According to AREP consult, patients admitted for substance toxicology need to have a whole serum or plasma blood work done to assess for the toxic agents. Other tests could assess for toxic agents like a urine test as well. A liver test could be administered to assess for damage and functionality of her liver since she has chronically been using substances and drugs. Because she's shaking, there could also be a sugar test ordered to assess for possible diabetes and low blood sugar issues. And then the research question. So, mental illness management includes both pharmacological and other therapeutic methods for treatment. Summarize how this is managed and the support of insurance. Is it sufficient and what can make it better? Okay, so pharmacologic treatment of mental health refers to the medications or drugs that we can supply our patients to help reduce their symptoms of illness. So, according to the textbook, there are many different categories of illness and pharmacologic agents that are used. Antipsychotic drugs are used to reduce symptoms of bipolar and schizophrenia disorders. Antidepressants are drugs that are used to help reduce the symptoms associated with depression disorders. Psychostimulant drugs help patients with attention deficits regain focus and complete daily tasks. Those are used for patients with ADD and ADHD disorders. Benzodiazepines are useful in the treatment of anxiety-ridden patients and provide them with a sense of calmness that they need to be able to complete their daily tasks. Therapy is also an essential tool in helping provide patients other coping mechanisms for dealing with mental disorders. Um, not everyone wants to rely on medications their entire life, and, the combination of therapy and drugs can really help a patient feel like they've regained a little bit of more control of their life. So, according to Family Doctor, not all patients experience mental health in the same way, and therefore there are many different avenues for mental health therapy. Psychotherapy or talk therapy, counseling helps patients by talking to an experienced professional that give the patients new insight on stressors in their life and how to help better manage them. Sometimes it helps to just talk to someone and get it off your chest. Eye movement desensitization and reprocessing therapy, or EMDR, works with patients to treat trauma and release stress surrounding traumatic events. Electroconvulsive therapy sends electrical charges to the brain that are believed by some to help create more normal chemical balances in the brain with those who have mental health disorders concerning, chemical imbalances and things like that. According to mentalhealth.gov, Medicare and Medicaid look at mental health as a necessity and provide their consumers with insurance that covers mental health costs, including substance use disorder services. So, a direct quote from their website: these services often include counseling, therapy, medication management, social work services, peer supports, and substance use disorder treatment. While states determine which of these services to cover for adults, Medicaid and CHIP requires that children enrolled in Medicaid receive a wide range of medically necessary services, including mental health services. So, being that Medicare and Medicaid are some of the most affordable insurance policies available, I would say that's pretty sufficient. However, I think most of the world thinks that their insurance policies do not cover mental health, so maybe making it more prominently aware that it's part of your coverage and easier to access how to cover it would be helpful going forward in battling mental health issues. Thank you.